403 pilot program. This is the first year that we're participating in that, and we have 4 residents here in family medicine who have rotated through or are going to rotate through this year. The closest VA facility to here is an outpatient clinic. It's about 40 miles away. That's just an outpatient only clinic. If they were going to get care at a VA hospital, they'd have to go to Albuquerque, which is about 3.5 hours away. And so we're able to provide a lot of those services much closer for our patients.
I like it here, and it's close by, and I could get treatment here. It's a nice place. It's a beautiful place, and people are real friendly here, and the doctors, nurses, everybody, and they try to help you out with what's going on with you and figure out what's going on.
What I like about training here is the variety of things I get to see. You get to see a lot of different things that you wouldn't necessarily see like in a big academic center, for instance. One thing that's different here is you have different programs here that aren't at other facilities. One being the street medicine program, which is actually really unique, I would say, to this area. With that, we treat patients where they are. So we're trying to help them provide medical resources where they can't really actually have them.
Hi, we're out here in Shiprock. We're doing our street medicine rotation. We do a lot of different things. We give out medications, we give out food, we give out some clothes, some socks. We also just help do treatment on basic things, check blood pressures, and also do like STD testing.
The patient population that we see at this facility are a lot of the indigenous population, a lot coming from the Navajo reservation. A lot of the patients say they like to get their care here, especially if they're from the veteran population, just because they come here, we have more resources. We do have a couple more specialists here compared to Farmington. We're able to get them a little bit more access to care.
I met her, she's a nice person, and she gave me all of what was going on with me, and understanding way, and I was satisfied with her.
Our patients in general, veterans and non-veterans, are just really welcoming. I'm always surprised at how welcoming they are to new learners coming through, but yeah, our vets are happy to work with our residents. They're happy to share their stories with them.
I pursued a rotation down in Chinle, Arizona, on the Navajo Nation at IHS there. I've been really impressed by how the VA is able to kind of meet veterans' needs kind of across the spectrum, and I think overall it's been a really positive experience. This was definitely my first time practicing or really having a lot of exposure to the Navajo Nation, so I definitely think it was a really valuable experience and just sort of gaining greater cultural awareness and understanding.
We send surveys every year to the residents, and the responses are really overwhelmingly positive. I think they like the full spectrum of care that we're able to provide. In the rural setting, they're able to do a lot more and sort of practice all of the skills that they've learned in residency.
I would consider working at IHS or a VA facility after doing my rotations, but it's the patients I really like to serve here. I like hearing their stories and understanding them. They're always so grateful for the care after we give it from here.
I feel like sometimes you encounter like a brand of humor amongst veterans that can be just really delightful. They're really resilient population, really tough, but also, have complicated health issues. So I think it's a big honor in a lot of ways to be able to be seeking to address those issues.
And I love treating veterans. They're always so thankful for the care they're getting here, and I think they're really appreciative of everything we're doing, and it's just a great population to learn from.